Welcome to the CIS 540 presentation from Team 6, Kevin Pedersen and Nicole Rogers. The topic for today's presentation is data warehouse design within the healthcare industry. There are two critical forces converging on the healthcare industry today: regulation and increased sensitivity to prices. Healthcare reform, commonly known as Obamacare, has brought increased regulations within the industry. There are new requirements for quality, reporting, confidentiality through HIPAA, and electronic transmission of data. At the same time, increased competition, along with other factors, has placed a higher focus on the cost of care. The resulting influence of these changes is that the healthcare organizations must find ways to improve patient care while also becoming more efficient and cost-effective. From a data warehousing perspective, data can no longer reside in isolated systems. Integrating clinical and administrative data is critical to long-term success. On the business side of the healthcare industry, there are two key players: payers, like insurance companies, and providers, like doctors or practitioners. From a data analytics perspective, healthcare insurance payers have traditionally focused on understanding costs, managing risks, and detecting fraud. Their goals were to make sure the prices being set were structured in a manner to maintain profitability. Healthcare providers have used data for preventative care and predictive analysis in the treatment of their patients. The current landscape of healthcare is creating a convergence of the needs of payers and providers. Shared risk delivery models, government regulations, and new quality measure requirements are requiring a single data source for analysis within the industry. Every patient's episode of care within a healthcare organization generates mounds of information. This patient-centric transactional data includes administrative information, such as the billing information from a claim. It also contains clinical medical information, such as services, test results, prescription orders, and outcomes. The issue in the healthcare industry is that these common dimensions, such as the patient, are hard to conform. The patient dimension has been challenging to conform because of the lack of a reliable national identity number and/or consistent patient identifier across facilities and physicians. By now, you are probably familiar with how Kimball's bus matrix provides a logical vision of how the business processes and events will interact with the proposed dimensions. This model breaks down several activities and actions along the left-hand side. These include clinical events, such as physician orders and lab test results, billing and revenue events, such as claims billing, claims payments, and operational events, such as bed inventory utilization or facilities utilization. Along the top of the matrix, there are potential dimensions, such as date, patient, physicians, employer, facility, diagnosis, procedure, and payer. The matrix shows how those dimensions will interact with the various events. The dimensional model for the claims billing process must address a number of business objectives, such as preparing bills and tracking the progress of claims. Healthcare analysts will want to analyze the billed dollar amounts by every available dimension, including patient, physician, facility, diagnosis, procedure, and date. They will also need to investigate how the claims were paid, what percentage of the claims have not been collected, how long it takes to get paid, and the current status of all unpaid claims. As you know, the grain of a fact table represents the most atomic level by which the facts may be defined. The transaction grain is the most fundamental level. This would include every billing transaction from the physicians and facilities, as well as every claim payment transaction received. The periodic snapshot is the grain of choice for long-running time series, such as bank accounts and insurance policies. However, it doesn't do a good job of capturing short-lived processes, such as orders or medical claims billing. The accumulating snapshot grain is to place every claim into a standard framework so that the analytical objectives described earlier can be satisfied easily. It is chosen to analyze the claims billing and payment workflow. It does not attempt to fully describe unusual situations. Normally, the dimensions surrounding a fact table take on a single value in the context of a fact event. However, there are situations where multi-valueness is natural and unavoidable, such as the patient having one or more diagnoses. There is a strong analytical incentive to retain the multi-value diagnosis along with the other financial performance data, especially as organizations do more comparative utilization and cost benchmarking. In this example, we have a claim billing line item fact table. However, there are multiple diagnosis codes for each billing line item. The diagnosis group bridge table provides the ability to support this one-to-many relationship. Healthcare providers are aggressively implementing electronic health record systems. The movement is significantly impacting healthcare data warehousing and business intelligence initiatives. Electronic medical records can present challenges for data warehouse environments because of their extreme variability and potential extreme volumes. Free-form text comments, such as clinical notes, are sometimes associated with fact table events. However, textual comments waste space when stored in a fact table directly. They should either be stored in a separate comments dimension or treated as attributes in a transaction event dimension. Sometimes the data captured in a patient's EMR can be an image. Attempting to store images in a database in a blob field can have significant performance ramifications. Healthcare organizations are also interested in more operationally oriented metrics, such as utilization and availability of their assets, like hospital beds and surgical rooms. In the case of operating room utilization and availability, you can envision a lengthy list of the status of transaction events, such as pre-operation, post-operation, and downtime. In the healthcare industry, the data warehouse often needs to contend with late arriving data. Especially in dealing with legacy applications, some data should have been loaded into the data warehouse weeks or months ago. The more delayed the incoming records are, the more challenging the data warehouse system's ETL processing becomes. Eventually, more effective source data capture systems should reduce the frequency of these late arriving data anomalies. The Enterprise Data Warehouse Bus Matrix illustrated the critical linkages between a healthcare organization's administrative and clinical data. We discussed the transaction grain as well as an accumulating snapshot grain fact table. We discussed medical records and test results, suggesting a measurement type dimension to organize sparse, heterogeneous measurements into a single uniform framework. We discussed the handling of text comments and images. In closing, we touched upon retroactive fact and dimension changes that are all too common within healthcare data. Creating a data warehouse in the healthcare environment obviously has some unique challenges, but the amount of data and the demands for more in-depth analytics of that data is growing rapidly. Thank you for taking the time to watch this presentation today.